Julie, you've come back today as a follow-up from your last appointment with us. At that point, we made a request to the foot surgery team to see you. Am I right in understanding that you're now going to have some foot surgery?
Yes, I think after everything we've done so far, the pain is now too bad, and I think foot surgery is the way to go.
So just to recap, we've looked at your footwear, and you've actually seen the orthotist, and they supplied you with footwear. We've sort of made insoles. We've tried a soft splint on the big toe to try and alleviate the problems around there. That helped for a while?
Yes, it's certainly kept my feet going for quite some time, but unfortunately they've deteriorated and the pain is now too bad.
So yeah, so it really is that pain that's sort of sending you towards this.
Yes,
Yeah.
yes.
Okay. So you've got a date?
Yes, 3 weeks' time.
Right, okay. And the team will have talked to you about what to expect on the day and how to manage the period afterwards?
Yes, some details, but not everything. There's a few questions I'd like to ask as well.
Okay, so have they told you it's day surgery you're having?
Yes.
Okay, so it's going to be under local anaesthetic?
Yes, and I think so, yes.
Yeah, okay.
So I wasn't sure quite how much I'd be able to do afterwards.
Mm-hmm.
When I come out, it's certainly in the first 24 hours or so what I'll need to do.
Yeah. I think the advice is that you will need somebody with you. So is there a family member or somebody that can help you? That's good.
Yes.
And did they then sort of talk about what you can expect of how you'll be the next few days and then a few weeks down the line?
In briefly, yes,
Yeah.
yes.
So I think the way it works is that sort of the first 24 hours you must have somebody with you.
Okay.
But ideally, at least for the next week, there's somebody there that's really there to support you.
Okay.
Because we talk about you should be resting, you should be elevating your leg, but that is really you're either on your bed, you are mobile enough to go to the bathroom, maybe then to lounge, to lie on the sofa.
Okay.
You really don't want that leg to be dependent, and you're probably not going to be able to put much pressure through it. You'll just be loading the back of the heel. They'll give you if you're not in a cast, they'll give you a surgical shoe to protect the foot, but it is really just loading to enough to stabilise you.
Okay.
So we'll need to also talk a little bit more about mobility and stuff. So that's kind of really the first week or so. By about week 2, you may be thinking they'll be looking to take the stitches out. But you might be able to load the foot a little bit more, but it's really partial loading. It's not full loading by any means.
Will I be able to walk around the house and, carry out even making a cup of tea or answering the phone and things like that? I
think ideally you want somewhere there to do it, because if you make a cup of tea in your kitchen, you've then got to get it to wherever you're sat, and if you're not able to load that leg properly, that's going to be difficult. You're going to need some sort of walking aid as well, and that's going to need sorting out, because with your hands, that's an issue.
I don't have crutches or anything at home, so do I need to sort that out beforehand, or will they give me those in the hospital and fit them properly and?
I think
given the surgery.
I think probably given the hand problems you've got, it would be a good idea if up front of your surgery we actually ask the therapy team to see if they can see you.
Yes.
Just to get those issues sorted out for you, because you don't really want to be going into the hospital on the day and finding that they haven't got the right device for you.
Because I won't be able to put weight through my foot initially at all.
No,
okay.
It is really just steadying you, and that's about it. Okay. And it's always through the heel.
Right.
So that really takes you the first couple of weeks. You're really quite restricted. You have the stitches out, and then you may, depending on what they've done, you may be able to get into an oversized trainer. But the emphasis is still on rest.
When you say rest, do I need to be confined to bed for a period of time, or can I walk around the house intermittently? Do I need to keep my leg up, or can I sit in a normal chair?
You need your leg elevated. So I think by elevated we mean at least level with your pelvis, if possible slightly higher, because it's all about gravity and stopping the swelling building up in your foot. The more the foot swells, the more painful it will be. So if you're getting pain, it's probably because of swelling at that time.
Right.
So in terms of your activity, it's really only do what you have to do, and that's those essential things.
Okay.
So you need to be thinking about having plenty of things to keep you amused during those first few weeks. So if you like your reading or whatever, that's the sort of thing you need to have arranged.
Okay. So I need to get someone to look after me.
You really do need somebody looking.
Week.
You do really,
yes.
I think, given your health issues. And, also plan up front. Think about, oh, you don't want this person in your, to be there to look after you, but actually they're dashing out each day to get food in. So try and have things prepared in advance so that they're actually there to help you as and when you need help, rather than they've popped out and you have to go and answer the front door and things like that.
Okay. How about showering and bathing, and generally, can I get the foot wet?
You need to keep it dry, and certainly while that first dressing's on, it needs to be kept dry. And you can get a sort of a protector, like a cast protector. So these are quite a strong plastic, and they come up sort of the probably 2/3 of the lower leg, and they've got a seal around them, so they will stop water going in. So you can use those in the shower. You've got to be careful that they are plastic, so you've got to be mindful of that in the shower.
Okay.
But yeah, they work very well. Once the main dressing's off and the stitches have been taken out, presuming the wound's intact, you may still have some sort of dressing on there. I would suggest still keep it using that sort of cast protector, and just wash the area locally, sort of independent of your general showering.
Okay.
You don't want to be saturating these sort of wounds.
Okay. And how long until I could get back to work or drive, for instance?
I think, again, that will depend on the exact surgery, and the surgical team will be able to advise you. But you probably won't be driving until you're able to more readily walk. So we're probably talking 4 to 6 week period.
Okay.
But you also remember you need to have a conversation with your insurance company on these matters.
Yes.
You don't want to get caught out.
Yes. In terms of my biologic drugs and the other rheumatoid arthritis drugs I take, will I be able to carry those on, or do I need to have a break in some of the drugs, considering I'm having surgery?
Yeah. With your biologic drugs, you will need to stop. So I'd suggest actually, you're only 3 weeks away from your surgery, so you need to have a conversation over the next few days with the rheumatology team, and they'll advise you when you need to stop prior to this surgery. And then they will be looking for healing before that you can restart. So you'll need to just keep liaising with them after the surgery, and they'll be able to advise you when you're ready to start again.
If I'm in pain after the operation, will I be able to take my normal analgesics, paracetamol and ibuprofen?
You will, again, the surgical team will have advised you, but you will be able to take your analgesia. I think with foot surgery is what's an indication of you doing too much, maybe, or the foot not being elevated for long enough, is that the foot will become uncomfortable. With swelling often comes pain as well. So it's an indication that maybe you're either doing too much or you're not elevating the foot long enough. So the first thing is to make sure that you are doing that, and you really are keeping off the foot in those first few weeks as much as possible. But yes, you will be able to take your normal pain relief. If you need a little bit more than you normally get, then the surgical team will be able to arrange that for you.
Okay. I noticed on the sheets that the hospital gave me, it said to take off nail polish. Why is that?
It's partly there's an infection control issue around it, but actually it's also they need to see your nail beds. Because actually they'll probably put a monitor on there and that's how they kind of monitor your pulse and stuff like that.
Okay. Post-operatively, is there any support that might be available for physiotherapy or any other exercises that will help me regain the use of my foot afterwards?
I think, again, it's one of those things, have a conversation with the surgical team. They'll be able to advise you if there's particular things you need. You'll be coming back into rheumatology as well, so if need be, we can always ask our sort of rheumatology-related physiotherapy colleague to see you. I think we need to see how you go, and also in terms of podiatry, we'll want to see you probably around about 3 to 4 months after your surgery, just to see how you're starting to adapt. If, because of the surgery, you're starting to walk differently, or it may be other parts of your foot start to compensate because of the surgery, we might need to just help with some sort of special insole or orthotic.
Okay.
But I think we need to just, once things have settled a little bit and the swelling's going down and you're in less pain, so you're more freely able to walk, then we need to recap in terms of where you are on your feet and what we need to do.
Okay.
I think the reality is you will still be seeing us, and we will still be needing to put stuff inside your shoes in this instance.
Is it possible to talk to anyone else that's had this type of surgery?
I think a good way of getting some support would be through the NRAS helpline. There they've got some trained volunteers, and one of them may have had an experience similar to what you're planning. So I'd suggest give them a call.
Thank you so much for all your help. I feel much more reassured now.
That's a pleasure. Thank you.